Resuming debate, the honourable member for Vancouver Kingsway.
Thank you, Madam Speaker. It's an honour to rise on behalf of my New Democrat colleagues and support this motion that would declare November of each year as Diabetes Awareness Month. Madam Speaker, Canada's New Democrats strongly believe that the federal government must do more to support Canadians living with diabetes, particularly those who incur significant out-of-pocket costs as a result of this chronic disease. It would certainly be a missed opportunity on the eve of the 100th anniversary of the discovery of insulin in Canada if we fail to ensure that every Canadian living with diabetes can afford to access insulin. The reality today, however, is that many Canadians living with diabetes are unable to afford the medications, devices, and supplies they need. This cost-related non-adherence can lead to avoidable complications and needless mortality. It also adds unneeded cost to our medical system. Canada's New Democrats believe there is an urgent need for a universal, comprehensive, and public pharmacare plan to ensure all Canadians have access to the medications they need when they need them. This must include coverage for diabetes devices and supplies such as test strips, syringes, insulin pumps, and continuous glucose monitors, in addition, of course, to the life-saving insulin. Now, individuals with diabetes cannot regulate their blood sugar properly. Diabetes causes many physical health issues, and it is the cause of death for more than 7,000 Canadians every year. Diabetes also affects the mental health of people who have diabetes as well as their families. Most people in Canada, over 90%, living with diabetes have type 2. Type 2 diabetes occurs when the body does not respond properly to the insulin it produces. Treatment includes medication and lifestyle changes to diet and exercise routines. Type 1 diabetes occurs when the pancreas stops producing insulin. Type 1 diabetes cannot be prevented, and someone with type 1 diabetes will always have to use insulin, either through daily injections or through an insulin pump. Now, in 1921, Dr. Frederick Banting, Charles Best, James Collip, and their supervisor, James MacLeod, discovered insulin in a University of Toronto laboratory. This discovery revolutionized the treatment of diabetes worldwide and remains among the most celebrated medical discoveries in Canadian history. Yet today, many Canadians living with type 1 or type 2 diabetes are unable to afford their medication, devices, and supplies they need. According to Juvenile Diabetes Research Foundation Canada, a population-based study in Ontario that tracked 600,000 patients found that roughly 830 young and middle-aged patients die each year from lack of access to insulin. On the other hand, according to a brief from the 100 campaign, Santé Diabète, T1 International, and Universities Allied for Essential Medicines, as many as 5,000 deaths in Ontario alone could have been prevented by universal drug coverages for people with diabetes. Now, here's some key facts and figures. Diabetes prevalence in Canada has doubled over the last decade. In Canada today, 11 million people live with prediabetes or diabetes, and every 3 minutes, someone in Canada is diagnosed with this progressive chronic illness. The life expectancy of a person with diabetes is shortened by an average of 13 years. By 2028, it is estimated that over 13 million Canadians, or 32% of our population, will have diabetes or prediabetes conditions. Diabetes contributes to 30% of strokes, 40% of heart attacks, 50% of kidney failure requiring dialysis, 70% of non-traumatic leg and foot amputation, and the largest proportion of cases of blindness in people under the age of 50. The full cost of diabetes to the healthcare system in 2018 is estimated at an astounding $27 billion. If disease proliferation continues by 2028, the price will exceed $39 billion. More disturbingly, a recent report from the Canadian Federation of Nurses Unions found that 57% of Canadians with diabetes reported failing to adhere to their prescribed therapies due to affordability, issues related to medications, devices, and supplies. Now, people living with type 1 diabetes can pay on average up to 17% of their annual income on diabetes. People living with type 2 diabetes typically pay on average up to 9% of their annual income. And about 18% of people with diabetes report having difficulty getting insurance because of their disease. That puts into perspective, Madam Speaker, this government's delay and failure to bring in national universal comprehensive public pharmacare, which this party, the NDP, has been calling for several decades now, which the Liberals promised to bring into Canada in 1997, and which they have done nothing but talk about for the entire 4 years of their administration. And while the Liberals have dawdled, Canadians have gotten sicker and many have died. And that's why the urgency of universal pharmacare that the New Democrats have repeatedly brought to this House is something that is a shame that these Liberals have refused to pay attention to. Internationally, although the World Health Organization recommends every country have a national diabetes strategy, Canada's previous strategy fizzled away in 2013, this time under the Conservative watch, following a scathing report on its underperformance by the Auditor General. Now, Canada's New Democrats believe the federal government must support the development and implementation of a new national diabetes strategy based on the Diabetes 360 framework that was developed in 2018 by Diabetes Canada and dozens of other stakeholder groups, and should facilitate the creation of type 1 diabetes and Indigenous-specific strategic approaches, the latter to be led and owned by Indigenous communities. Furthermore, Canada's New Democrats believe the Government of Canada must support Indigenous-led diabetes programs, services, and research priorities, and prioritize food sovereignty, provide access to appropriate care, treatment options, traditional healing and medicine, and raise awareness about gestational diabetes and the increase in diabetes among young Indigenous women. Diabetes is rising the fastest, Madam Speaker, among Indigenous people in this country, primarily Indigenous women. In addition, Canada's New Democrats believe there is an urgent need for a national approach to pharmacare that again would ensure all Canadians living with diabetes have access to the medications they need when they need them. And this must include coverage not only for insulin, but the devices that we talked about. Madam Speaker, our Health Committee heard heart-rending stories from real people who told our committee about their challenges living with diabetes. People who woke up in intensive care when they didn't know how they got there because when they were sleeping, they went into diabetic coma. We heard stories about people who said that, that by landing in intensive care for 3 days, they cost the system more money in those 3 days than it would cost to provide them free insulin for their lifetime. We heard stories of, from Rowan Burridge from British Columbia, who said that she had to leave Nova Scotia and Saskatchewan after discovering big differences in what provincial health plans cover. And again, the Canada Health Act is supposed to provide equal coverage for Canadians as one of the bedrock 5 principles of the Canada Health Act, so that every Canadian everywhere can get the coverage they need. But that is not the reality in Canada today, because successive Conservative and Liberal governments have failed to enforce the Canada Health Act or bring in universal pharmacare. Rowan told us that she spent more than $70,000 over the last 10 years just to keep herself alive with the insulin she needs to treat her type 1 diabetes. She said that she had extended health benefits through her job, but that her plan excluded insulin, and her additional insurance is capped at $7,000 annually for her treatment needs. Madam Speaker, Charlene Laverne from Oshawa, Ontario told us she'd been living with type 1.5 or type 2 diabetes for 43 years. She told us, "I'm 63. If I had universal pharmacare coverage, it would mean I could look forward to seeing my 4 granddaughters grow up, and I could live with less anxiety and stress. I would know that it was there for me. I wouldn't have to scramble. I wouldn't have to just about sell my socks for stuff. Having the right insulin too, that's the key. I need to have the right insulin, not the cheapest insulin on the market. Basically, public pharmacare would give me hope, and it would give me a little bit more cash so I could eat." Madam Speaker, those are the kind of stories we're hearing from real Canadians. This is for whom the NDP fights. This is why we will not stop until we bring universal, comprehensive public pharmacare to every Canadian, just like the NDP brought health care to every Canadian in this country. Thank you.